In this nursing mindset video, we will discuss perioperative nursing. Now, when many students first learn about surgery, they tend to just divide everything into three separate phases: preoperative, intraoperative, and postoperative. While understanding those phases is important, I want you to think beyond simply memorizing what happens during each one. Instead, ask yourself one question throughout the entire perioperative experience. What could go wrong next? That single question will help guide your assessments, your interventions, and ultimately your clinical judgment. Let's start with the preoperative phase. Before surgery ever begins, our job is to identify anything that could increase the patient's risk. We complete a thorough assessment, review medications, allergies, laboratory results, and medical history, while also making sure informed consent has been obtained and the patient understands what to expect. But instead of simply checking boxes, ask yourself, what risks am I identifying before surgery? For example, if your patient smokes, what complications are they more likely to develop after surgery? If they're taking an anticoagulant, how might that affect bleeding? If they have obstructive sleep apnea, what concerns might you have once anesthesia is administered? The goal isn't to memorize a list of risk factors. It's to understand how those risk factors influence patient care and what they mean for your patient during and after surgery. Now let's move into the intraoperative phase. Once the patient enters the operating room, they can no longer protect themselves or advocate for their own safety. At that moment, the surgical team becomes their advocate. Think about everything that happens during surgery. We maintain a sterile environment, perform the surgical timeout, verify the correct patient, procedure, and surgical site, protect pressure points during positioning, monitor body temperature, and perform instrument and sponge counts. Every one of these interventions has the same purpose: to prevent complications before they happen. Instead of asking, what task do I need to complete? Ask yourself, what complication am I trying to prevent? That small shift in thinking is what separates task-oriented care from clinical judgment. Finally, we reach the post-operative phase. Now our question changes slightly. Instead of asking what complications can we prevent, we ask what complications could develop next. This is where your assessment skills become critical. As you're caring for your patient, think systematically. Can they maintain their airway? Are they breathing effectively? Could they be bleeding? Are they developing signs of infection? Are they retaining urine? Are they at risk for atelectasis or deep vein thrombosis? Notice that we're not completing assessments simply because they're on a checklist. Every assessment is looking for an early clue that something may be changing. The earlier we recognize those changes, the sooner we can intervene, helping prevent minor problems from becoming major complications. Now, at the bottom of this graphic, you'll notice the nursing process laid out in a way that mirrors clinical judgment. We begin by assessing the patient and gathering data. Next, we anticipate the complications this particular patient is most at risk for. Then we prevent those complications whenever possible through evidence-based nursing interventions. We continue to recognize subtle changes that may indicate a developing problem. And finally, we act by implementing appropriate interventions, communicating with the healthcare team, and advocating for our patient. This is exactly how nurses think every day in practice. I'd like to leave you with one final thought. As you continue to learn about perioperative nursing, remember that great nurses don't simply react to problems. They anticipate them. Every assessment you perform, every intervention you implement, and every decision you make should be guided by one simple question: what could go wrong next? When you begin thinking this way, you're no longer just completing tasks, you're recognizing risks, prioritizing patient safety, and strengthening your clinical judgment before complications occur. That's what transforms knowledge into nursing practice, because that's the nursing mindset. Keep developing yours.